Okay, I'm going to go ahead and point out some surface anatomy. And again, as we looked at in the lumbar spine, surface anatomy is critically important for joint-specific techniques in the cervical spine. And so in order to isolate our mobilization techniques to a particular segment, we have to be able to locate some bony landmarks. And the cervical spine can be really challenging because the spinous processes can be hidden by the nuchal ligament as well as the paravertebral muscles. Some of the things that we can look at in the upper cervical spine that we've looked at before is that we can find the lower border of the occiput right here where my finger is. And then if I follow off of the occiput a little caudally to that, that's where we found the C2 spinous process, which is what we use for alar ligament testing. I'm going to come around here a little bit more lateral, and one of the prominent structures that we have here where my index finger is the mastoid process. And so the mastoid process is the insertion point of the sternocleidomastoid muscle. We can also go off of the mastoid process slightly ventral and deep to the mastoid process is the transverse process of C1, and that's going to be useful for us a little bit later when we look at the thoracic spine, but I do want to kind of point that out. So we find the mastoid process, just ventral and medial and deep to that mastoid process, we'll find the lateral border of the C1 transverse process. So for my mobilization techniques that we're going to perform in the cervical spine, we're going to really need to be able to isolate the levels, and the challenge is that after we leave C2, the spinous process has become a lot harder to palpate, particularly as I mentioned before because of the ligamentum nuchae and then the soft tissue structures in the cervical spine. So what we're going to do is we're going to use some ventral landmarks to help us locate the levels of the cervical spine. And so the first thing that we can look for is the hyoid bone, which is a structure that's one of the muscles of mastication, where they insert at the omohyoid bones and the suprahyoid muscles that insert there. What we can do to make sure that we're on the hyoid bone is have the patient swallow. I'm going to swallow, and we'll feel the hyoid bone move out from underneath my fingers. And so there's the level of C3. If I come down just a little bit here, on the top there's a little V notch located right where my finger is, and that's the level of C4. That is the ventral indentation of the thyroid cartilage. Then if I go down a little bit further, I can find a level of C5, which is going to be at the body of the thyroid cartilage. And then the cricoid cartilage, which is this little roundish structure right here, and just below the thyroid cartilage, we have the cricoid cartilage, which is going to give us the level of C6. And so again, if we're treating a patient, we're going to perform mobilization techniques, I can just use my ventral landmarks to try and locate the level that I want to treat. So again, for the indentation here, the ventral indentation of the thyroid cartilage, we can locate the level of the C4 lamina. Thyroid cartilage is going to be the level of the C3 lamina. The body of the thyroid cartilage is going to be the level of the C5 lamina, and then the cricoid cartilage is going to be the level of the C6 lamina. The other thing that we can look at for C6 is generally C6 is, as we extend, C6 will translate ventrally, and that's one of the things that we can do to confirm the location of C6. So we're going to use these ventral landmarks to help us be a little bit more specific with our mobilization techniques in the cervical spine.